Guide to Legg-Calve-Perthes Disease, LCPD. The video is created by Dr. Abhinav Gupta and team. In this video we have covered everything about the topic from initiation to the end. Legg-Calve-Perthes disease, also known as Perthes disease or simply Perthes, is a childhood condition affecting the hip joint. It involves the temporary interruption of blood supply to the femoral head, leading to the gradual deterioration of the bone. Clinical features. 1. Limping, typically the first noticeable sign, especially after physical activity. 2. Hip pain, discomfort or pain in the hip, groin, or knee. 3. Limited range of motion, decreased ability to move the hip joint freely. 4. Muscle atrophy, weakening and wasting of muscles around the hip. 5. Shortening of leg, in some cases, the affected leg may appear shorter. Signs and symptoms. 1. Pain, mild to severe pain, often aggravated by activity. 2. Limp, an antalgic gait due to pain and stiffness. 3. Reduced joint flexibility, difficulty with movements like hip abduction and rotation. Classification. LCPD is often classified based on the extent of involvement and severity, typically classified into stages, such as the Catall classification, I to IV. The Catall classification is a system used to categorize Legg-Calve-Perthes disease, LCPD, based on radiographic findings. It classifies the disease into 4 stages. 1. Catall Stage 1, initial. Less than 50% involvement of the femoral head. No significant deformity or collapse. 2. Catall Stage 2, fragmentation. More than 50% involvement of the femoral head. Fragmentation and mild deformity, but no subluxation or dislocation. 3. Catall Stage 3, reossification. Significant involvement of the femoral head with fragmentation. Increased deformity and subluxation. Reossification, reformation of bone, begins. 4. Catall Stage 4, residual. Extensive involvement of the femoral head with significant deformity. Joint incongruity and possible degenerative changes. Residual deformity post-reossification. The Catall classification helps guide treatment decisions by providing insights into the severity and progression of Legg-Calve-Perthes disease. It's important to note that individual cases may vary, and treatment plans should be tailored based on the specific characteristics and needs of each patient. Consulting with a healthcare professional is crucial for accurate diagnosis and appropriate management. Radiographic assessment. X-rays play a crucial role in diagnosing and assessing LCPD. They help in visualizing changes in the femoral head, joint space, and the extent of involvement. The stages are determined based on the appearance of the femoral head and the degree of collapse. Treatment for Legg-Calve-Perthes disease, LCPD, may involve various approaches depending on the severity and stage of the condition. Besides physiotherapy, other treatment options include 1. Observation. In mild cases or during the early stages, observation and regular monitoring may be recommended. 2. Casting or bracing. Maintaining proper positioning of the hip joint through the use of casts or braces to support healing. 3. Joint distension. A procedure where the hip joint is distended with fluid to improve mobility and reduce pain. 4. Surgical interventions. Osteotomy, surgical bone cut to realign the hip joint. Hip decompression, removing obstructive tissue to improve blood flow. Joint reconstruction. In severe cases, reconstructive surgery may be considered. 5. Physical activity modification. Limiting high-impact activities to reduce stress on the hip joint during the healing process. 6. Weight management. Maintaining a healthy weight to reduce excess load on the affected hip. 7. Anti-inflammatory medications. Non-steroidal anti-inflammatory drugs, NSAIDs, may be prescribed to manage pain and inflammation. Physiotherapy goals and management for Legg-Calve-Perthes Disease, LCPD. 1. Pain management. Alleviate pain through modalities like ice packs, and later, by promoting joint mobility. 2. Maintaining range of motion. Implement exercises to prevent stiffness and maintain flexibility in the hip joint. 3. Strengthening muscles. Develop strength in muscles around the hip, particularly the abductors and external rotators. 4. Postural correction. Emphasize proper posture during daily activities to reduce stress on the affected hip. 5. Gait training. Address abnormal gait patterns to improve walking mechanics. 6. Functional activities. Incorporate activities of daily living to enhance overall functional mobility. 7. Education. Provide guidance on adaptive techniques and lifestyle modifications to manage symptoms. 8. Monitoring progress. Regularly assess and adjust the physiotherapy program based on the patient's response and progression. 9. Bracing or orthotic devices. Utilize braces or orthotic devices to support the hip joint and aid in maintaining proper alignment. 10. Coordination and balance exercises. Enhance coordination and balance to improve overall stability during movement. 11. Patient and family involvement. Educate both the patient and family on the importance of consistent exercises and adherence to the physiotherapy plan. Physiotherapy plays a crucial role in the comprehensive management of Legg-Calve-Perthes disease, aiming to optimize function, minimize pain, and support the natural healing process of the hip joint. The specific physiotherapy program should be tailored to the individual's needs and guided by healthcare professionals. Regular communication with the healthcare team is essential for monitoring progress and adjusting the intervention as needed. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.